Smitha Chowdary K, Vice President, Women and Children's Unit, Continental Hospitals.
Good evening, everyone. I'm sure all of you are tired by now. I'll keep it short. So how many of you have actually Googled, instead of going to your doctor, about what disease you might be having? How many of you? I'm sure pretty many more than the ones who are accepting here. And out of them, how many of you have identified what your disease was even before you went to the doctor? No? But I'm sure pretty much some of them will be able to do that. But how do we do that?
Can you all settle down for 2 minutes?
We actually do that by matching our symptoms to set of signs that are mentioned in the website. So it's kind of answering series of questions and then coming to a conclusion, isn't it? And that's what a doctor does as well. So medicine is nothing but having a source of knowledge who can actually ask you those series of questions and then match it to a series of patterns and make a diagnosis. Now, if medicine is just an exercise of data assimilation and then matching it to patterns, doesn't it make sense for a machine to be able to do that as well? How many of you agree? Yeah? Okay, so we are exactly in a time where this is very much possible. Let me take you on a small journey. Okay, imagine, I want you to put down your phones and just listen just for 3 minutes. So imagine 4 to 5 years from now, you wake up with persistent headache. It wouldn't go away. You reach out to your smartphone, a healthcare app which has AI inbuilt into it would assess your symptoms, and then it makes a conclusion that you would need to see a specialist, to see a doctor in the nearest healthcare facility, all on your smartphone. As you enter the hospital, you see that the environment is quite different to what you're used to it now. Gone are the long queues. There is no crowded corridors. Instead, you're invited by a warm, welcoming virtual assistant, which will quickly scan your QR code from your smartphone to access your appointment. Now, that's reducing the time that it is going to take, and it's also going to reduce the human errors that could be possible. And then you're then directed to a self-check-in kiosk where you give your basic information. In seconds, you get an alert on your phone, and that alert is a virtual map which will guide you to the department that you should be going to, the specialty that you should be visiting in the hospital. Now, as you walk to the department itself, the app will give you information about the other services that are available in the hospital, the care team that is available for you, and also gives you an estimate of your waiting times. As you enter the department, you see that there is use of cutting-edge technology everywhere. There are automated self-assessment, health assessment bots where you could go and quickly check your vitals. And then the information from that bots are transmitted to your care team immediately. And the care team will be able to prioritize the patients based on the severity. And then you see your first primary healthcare provider, who is a trained healthcare nurse practitioner, and she greets you in a room which is designed to keep you relaxed. The walls of the room have immersive landscapes, digital immersive landscapes, which are designed to keep you anxious-free and foster relaxation. While the questions are being asked about your physical symptoms, you're also asked about your emotional well-being. You're also asked about what stresses you have in your life and how your lifestyle was in general. And now this nurse practitioner would be wearing augmented reality glasses, the ones that we were discussing about. And these reality glasses will enable her to make instant observations and access your medical records instantly. You could do that. And then she makes a decision that you will need to see a specialist, in that case, based on your symptoms. And that specialist you see through a holographic interface, because the specialist is somewhere else. You access, and the specialist does the consultation, he guides you on the next steps, you go to a lab, In the lab, there are robots that are doing the sample collections, again reducing the amount of time and human errors. And then as you walk out of the laboratory, you meet your care coordinator who will summarize the entire visit, give you the management plan, treatment plan, and give you any necessary prescriptions. You're then given a follow-up app, a personalized follow-up app where you'll be able to get reminders of your medicines, diet, and exercise. Now, as this entire visit is ending, you complete your billing on an automated billing system just on your smartphone, review it, pay for it, and you're out of the hospital. So when you're out of this hospital, what do you feel? This is the future that we will see in 4 to 5 years' time. But this future is only possible if the hospitals think of designing a patient-centered care delivery system which has minimized administrative burden, utilizing the advanced technologies, putting them all together. And it's creating a holistic and effective approach that way. But are we really ready for it? Are we creating technologies that are fit enough to enable that kind of holistic experience? Let's look at what we use right now. So all of us have smartphones, and all of us use the smartphones to check our vitals. We have wearable devices now where we can check our blood sugars, monitor them for 2 to 3 weeks, and the data is transmitted to the doctors now for them to make decisions about our treatments. That is happening now. And we are also using lots of apps for our, be it diet, exercise, or for booking appointments. All of that is happening now. And in the next version, it's going to get better. Like how we have smartphones now, all of us will have personalized digital health assistant as well. So as you wake up, all of your biological outputs would be measured, and that data will be analyzed on a daily basis to form a profile, a biochemistry profile for you for that day. And then the data from that could be sent out to multiple devices that you're using, or to multiple people who are part of your, people who are in your system, your ecosystem that keeps you healthy. Now that data could be sent out to, I would call them culinary planning experts, units, or better cooks at home about our dietary needs based on the findings from the healthcare data. And it could also be sent out to the fitness coaches to design fitness program schedule based on your requirements. And in cases where the data says that you're ill, it could be sent out to your emergency contacts. And it could also be utilized to make health points, which can be utilized to measure your, calculate your insurance premiums. And it could also be used to tap into a lot of other advanced services. These health points could be utilized for that. Now, all of this is possible, and as I describe all of this digital revolution in healthcare, one thing we notice is that this is augmenting our health. But what are we doing with the care? Right? Doctor-patient relationship is the oldest form of professional relationship, and it is known to actually make an impact on healing, how the patient heals and recovers. Now that trust in a patient, the patient-doctor relationship is built over time. Either it is built over time with your doctor, or otherwise it is built based on the professional journey of that particular doctor itself. But how, as you go deeper and deeper into healthcare evolution, technological evolution, if the role of the doctor is minimized, where do we place that trust? Do we place that trust in the machine? Do we place it in the manufacturers? Or are we even really ready to accept, to trust something where we can't build a relationship at all? So I know a lot of the people who have been here have left, but those who are here, there are people here who could be building businesses, who could be startup founders, who could go on and develop technologies which could be part of this new ecosystem. And I just want you to take a moment and think about this. Think about what kind of technologies you want to build. I would say design your technologies for trust. While you utilize your intelligence to build the technologies, design them with your emotions. And remember the essence of being a human. And only then those technologies will go on to augment the experience of the patients and make a true difference to them in long run. So as a healthcare, in my current role as a healthcare leadership role in my current organization, if I am to look at a healthcare technology, I would be looking at something that would actually make a difference this way, something that is designed with emotions in mind. So I would leave you today with just one request. The next time you go to a doctor physically, trust him or her, smile and cherish that moment, because you never know how many more such visits you may have in the future. Thank you.